patients, and so we kind of miss them. But every now and then we'll catch them in the lobby when they're waiting on that appointment, and we'll go out and talk and catch up.
Right on. Mm-hmm. So for you, Lauren, what was that like in terms of going into a center for your checkups? What have you been able to develop relationships with the staff and the people there? And what's that like?
I only have a relationship with my nurse, and she is absolutely awesome. I mean, like anytime I get into a snafu, she handles it within like minutes. And then it's like whatever orders I needed or whatever, something I needed faxed over or just medication called in, she is like on it. So she's my saving grace. She's my angel. But in the beginning, I was not so nice because I hate needles. And she had a partner at that time. And they actually were trying to give me 2 shots. I was like, no. And I actually literally walked out of the building. I was not nice. I don't do anything I don't want to do. So remember that.
Right.
So it's funny because now when she draws my blood, her hand shakes because she's like, I gotta get it the first time. And I'm like, yes, you do. And now that we have COVID, my husband used to come in with me and I used to hold his hand and he would rub my back or he would try to talk to me about something. But because of COVID, they won't let him in now. So he sits out in the car like during my hour session. And I just grab onto my heated chair and I'm like, and then she's shaking and she's but she gets my blood the first time. I'm like, did you get it? Did you get it, Julie? She's like, I got it. Sit still. And then she draws my blood. She actually, up until 2 months ago, was giving me iron. And I let her do my iron injections because my iron was low. But lately, my iron has been on target. So she hasn't had to give me iron injections, which is wonderful. So that's a good thing. But I think that's because I've been taking iron on my own. And it's been, erasing the levels, which is good. But I just enjoy her. And my nephrologist, Dr. Gupta, is amazing too. I love him. He actually does come to the office. He comes to the clinic, but I never see him in the clinic because he comes to see the hemo clients. I see him in his office. So, but he's awesome. And I just went to see my cardiologist in Gainesville, Florida on Thursday. And he said that he, a year ago, said that I was eligible to be on the list because I'm still not even on the list. So he said I was eligible to be on the list. And the what is it called? The kidney, I'm a pre-candidate for kidney list. So I talked to a lady on Thursday as well, before I even left the hospital. And she said she was just waiting for one of my results. I got that faxed over. So on Monday, there is they're going to do like a conversation with all the doctors to see who can be put on the list. And I'm hoping that I'll be able to get on the list for a kidney. The best part about that is if I get on the list, I will go all the way back to November of 2014. So that will hopefully fast track me to be able to be put on the list and get a kidney soon. So they'll let me know like Monday or Tuesday. And I'm excited about that because then I can get a kidney and go back to normal. Now, I don't know if I didn't tell you all, but I actually worked for 5 months. I did therapy work for 5 months, but it was hard for me to maintain because I started to get tired and sleepy when I was doing therapy. So I had to stop working, and I'm just back on regular Social Security. But I really tried to, get some extra money and work and everything, but it didn't work out for me. I really needed to take a break. So,
That's good that you were listening to yourself to be able to do that, because I know that you love to work so that you can travel. I get it. But you went into kidney transplants, which was the next thing I want to talk about. When you said that you go back to the list, like you get put on the list according to when you got ESRD, is that correct?
Yes, exactly.
That's interesting. I didn't know that. Did you know that, Maurice?
Yeah, I know they kind of like backdated, so to speak, and it goes back to the time that you started. So you kind of would move up in front of people who had less time than you with end-stage renal disease. The other thing is, and I was sharing this with Ira, is that what I found interesting was I was helping a friend who was trying to get on the kidney transplant list. And I came to find out that here in Ohio at OSU Medical Center, that a patient can be put on the list at 20% kidney function. And most of the time, patients don't start on dialysis until they're below 15%. And I thought that was interesting. You know, and I don't think patients are made aware of that. So, you know, just that point that you could have been worked up for a transplant before you ever had a day of dialysis is extraordinary. And I think that's one of the things that we want to talk about here, is to make sure that people check that out. They figure out that if they're going to, in fact, you know, try to get on the transplant list, figure out maybe they can be on that list before they ever do a day of dialysis.
Right.
Really,
that would have been nice.
Sorry to interrupt. Maurice, just because some people might just watch this one episode, explain what the percentage is. Either one of you can explain that, and where you find that number in terms of your kidney function.
Okay. I mean, your GFR tells you exactly what percentage your kidneys are functioning at. And most of the time when you take you do your yearly checkup with your doctor and they draw your blood and take a urine specimen, they know what that GFR is. And basically your GFR is going to be anywhere from, 80% maybe all the way down to 25%. And then when you start getting a little bit lower than that, you may have a conversation. You may not have a conversation. You may not meet a nephrologist until you're 15%. Right. I mean, and so that's what we're trying to do here, is ask people to look at their labs when they draw their labs and their doctor says your labs are in, go in and look and find out what that GFR is. That's going to tell you where you are in kidney function right away. And if you're 25% or 35%, I mean, you're getting there. And that's when you should be having those conversations with your family doctor. You should be saying, hey, I need to see a nephrologist now. I need to see a nutritionist now when I'm at 35%. Don't you wait until I'm 15% and call me in and tell me you're going to walk me over to the dialysis center and this is where I'm going to be having dialysis, because that's exactly what's happening.
Got it. So Lauren, in terms of yours, you're finding out. So once you're on dialysis, do they still track what your percentages are, or I mean, do they ever increase? I mean, does your function ever increase, or does it just stay where it is?
It stays where it is. They do something called a KT over V, where every 3 months they check my dialysate, like whatever's output. I have to bring my bags in, and also a 24-hour urine. And then they check it and they see they want to make sure, number one, that the dialysis is working. And then they also check my GFR, and I think I'm at 12% right now. So I've maintained that since I was diagnosed. I think when I was diagnosed, I was at 15. And I wasn't feeling any symptoms. So they were like, they left me alone. They're like, well, you're still doing well, da, da, da. And then after that, I started having metal taste. I started to be tired all the time, itchy. And I was like, oh my goodness. So, and then the breathing was the thing that really got me.
So the issue is that your red blood cells are in a toxic environment. And they can't carry oxygen, and that's why you find yourself short of breath. But I tell you, you speak about KT over V, and in the dialysis in-center environment, we check that KT over V probably once a month.
Oh.
And we're checking that to see, where that is. And our goal is 1.4. I have had nightmares where I've seen patients who are getting close to a 2 KTRV, which means the dialysis is working so well that they probably could come in for 2 days a week as opposed to 3. And I've watched doctors dummy down their treatment. And what I say dummy down is they put them on a smaller dialyzer and they reduce their blood flow rate so that KTRV is not as high as it is, because when a KTRV is at 2, the government doesn't want to pay. And so, this is a thing that people don't know and they don't see, because as technicians, we see the inner workings of what these companies are doing. And, that was just one of the nightmares that I saw for a hemodialysis patient. There was a young lady and she was on dialysis and her KTRV were like 2. And the doctor's like, oh, these KTRVs are too high. They're not going to pay. So to keep her on center, in center for 3 days a week, 3.5 hours of treatment, they dummy down her treatment. They lowered her blood flow rate. They put her on a smaller dialyzer so that her KTRV wouldn't be that high. And I was appalled. And we can't say anything, because if we say something, we don't have a job. And so that's why I'm doing this, because in those situations, my heart told me I need to do something. But I've got kids, I've got grandkids,
right.
I have a mortgage, I have a car payment, and you have to draw a line. And this is me drawing the line right now. This is me drawing that line. And so that's what I was seeing. Yes, that's what I was seeing. And so, this gives me the opportunity to tell it. This gives, in the context of your story and other people's stories, and we can bring these things out and we can bring these things to fruition. People can see what's happening to them.
That's interesting, because my results for K2/V teeter between like 2.7 and 3.25 or something like that.
Yes.
So, but nobody says anything to me about it. It's just like, thank you. I'm glad you're doing, because they're glad that it's working. Because if it wasn't working, I guess I don't know. But I do ask for a kidney. Every time they would say, well, why is your blood pressure a little high? Because I need a kidney. That's why. And that's exactly what I said. Tired y'all asked me that. That the kidneys affect the heart. Yeah. You know what I mean? Like, stop asking me that. And I learned I'm on more medications than I have been. And I'm like, why do I have so many this week? And my blood pressure still isn't going down. And,
right.
And it's just affecting my body to the point that I just don't feel like myself anymore. Like, I'm great. I'm glad that the dialysis is working, but the medications aren't.
Yes.
And that's an issue for me too. And I'm not sure which one is not working. I'm not sure which one is giving me, like, making me feel groggy all the time. I'm not sure which one anymore is making me feel short of breath, because I'm back to being short of breath at night. And so I'm like sitting here trying to like figure out which one might it be. I think I might have to lower this one. And they allow me to lower my meds, which is not a great idea. But
I figure it out.
They're just like, if you want to increase it, you want to decrease it, that's fine. I'm like, okay, great. So now I got to play sciences. But I appreciate, Maurice, that you are advocating in this matter. It is so important. I just feel like there's not a lot of advocacy in regards to kidney disease. And the thing is like, we need machines and dextrose to be able to survive. Like, if we don't have that, within a couple of days, we're dying. And it's like, where is the advocacy? I mean, there's advocacy for heart, for the heart and heart disease and diabetes and so on and so forth. Where is the advocacy and the awareness for kidney failure? Exactly. I don't understand. And where's the money? You know what I mean? Like, I think I've complained before. I don't have access to supplemental insurance. Why is that? And, I'm hoping with Biden being in that, I'll be able to access stuff, insurance, so that I can get my teeth done. And I actually went to work I forgot to say, I went to work so that I could get medical insurance so I could get my teeth done. I got my teeth done, then I quit. So, because that's what I had to do.
Yeah.
But where is the advocacy so that we can get supplemental insurance? We are on Medicare. That's great, 80/20. But we need to have access so that we can get dental. I can get my lady stuff checked out. You know what I mean? Like, I'm not getting all of that done.
Wow.
I can die through that. You know, I can get toxic through my teeth not being done.
Mhm.
You know what I'm saying?
Yeah.
And so that's what I hope that we can form some type of advocacy and awareness. I really want to talk to our legislators and help them understand that we don't have medical insurance. And this is what could happen. And I have a couple of friends who are legislators that I can chat with and maybe get them on board to maybe help draw up a bill to see if we can, at least in the state of Florida, allow people who are on who have end stage renal disease to be able to access medical insurance.
Yes.
Because this is ridiculous.
Yeah, it's
Yeah.
super important.
Yeah.
And I think that's one of the rules for getting on the transplant list. You have to see a dentist, don't you? I mean, I think you have to see a cardiologist.
Oh,
Okay.
yes, I do. Yes, I do.
Yep. Yeah, so that's one of the rules of getting on transplant list. You have to see a cardiologist, you have to see a dentist, you have to see a psychologist. All those things are part of that. Yeah,
mammogram.
Part of that. Part of that process, and you know, that's certainly important. I think just getting back to the KTO review really quickly, we know that PD is the best form of dialysis. You are, in fact, on the best form of dialysis that we could create. I mean, we know that it is best. And, you know, you're so lucky because let me just say to you, 8 years ago, every patient that came out of a hospital in this country was put in an in-center dialysis center and was not offered PD. And the government had to step in and force them to do it, mandate them to do it, tell them that we'll pay you the same amount of money as we pay people who are in center is that you get when you're at home. Because if they didn't do that, it was a piss poor record. I mean, we had 10% of the patients in this country on the best form of dialysis.
Right. That's crazy.
We've got to do better.
And that's all about the money. And that's what this conversation is about. And Lauren, being who you are, I can tell that there's going to be more conversations on the, like, how do we get it done tip? You know what I mean? Right. And that's what this is about. It's putting the minds together so that we can affect change. We're going to bring this installment to a close here. But we're going to continue the conversation. And we definitely want to get you with Alfila and with Paul. And we need to, I think, you know, coming up, we're due for like a larger conversation.
Yes.
So we can chop it up and maybe be a little bit longer. But, you know, I know you'll come back. I know that you are, I saw the light bulb go off when you're like, wait, something else I can fight? And I know that seed has been planted. So we'll come back to this. Thank you. It's great to see your face, your red hair, and that you know you keep reinventing yourself and you keep pushing. You know, I'll just say for anybody watching, definitely check out Lauren Cephas. She's doing her thing in Jacksonville, Florida. Yeah. You'll see her out on the town square with a microphone, with her fist raised, with her grandson by her side, telling people we're not going to take it anymore. And I'm proud of you. And
thank you.
We are proud.
And Maurice, we're going to keep doing the do, you know, and we're going to make change. We're affecting change. People are learning. I'm learning, and it's great. I'm in a great position to not know enough to like ask the questions and have you guys give good answers that other people might need the answers to. So with that, we're going to say goodbye for this one. And hope everyone just stays well, you know, definitely be an advocate for yourself. And with that, we'll say peace and goodbye.
Thank you,
Peace and
Lauren.
respect. Keep the power
Peace.
alive.